Good morning. I'm Dr. Borromeo. I'm an internal medicine specialist at the Red Lake Hospital.
Hi, I'm Carmen Briones. I'm one of the pediatricians at the Red Lake Hospital.
Hey, I'm Dr. Federico Tinsay. I'm also one of the pediatricians at Red Lake Hospital.
So there is a plan already in place to triage patients. So we try and separate them by symptoms. Certainly, right now, there's no specific entrance designated for those patients. However, yes, there is a plan in place already to separate that out. And so that is why we encourage you to contact the hospital first. If you're worried about symptoms, if you're going to be coming in concerned about symptoms also, so that we can prepare also if you do present to the hospital.
Also, I may add, at this point, we're in the planning stage. So at some point we do start getting a lot of respiratory illness related to COVID. The hospital does have a particular plan in segregating people with cough and cold symptoms into a specific clinic area so they can still be continued to seen. Right now, since we don't have that much cases, in an effort to avoid sick patients being mixed with the well patients, we're trying to schedule all sick patients, usually, especially with respiratory symptoms, in the morning. So that's what we're doing right now. But as the need arises, if more symptoms, more cases arrives, then we do plan to have what we call a respiratory clinic at some point.
So just gonna add a little bit for what Dr. Tinsay mentioned. So our clinics are open right now. So we see all the well child care visits and all prenatal visits, everything else in the morning. So it's sort of like we have the clean hours during the day. So anyone who's not very sick or not sick at all can be seen in the morning, and anyone who's gonna be sick, well, we kind of cohort them in the afternoon hours so that at least after we see them, we can actually do more terminal cleaning and thorough cleaning after we've seen them and ready for the next day. So all the sick visits for now, it's in the afternoon, and then any well child. So to plug the pediatrics clinic, so we're seeing all babies still 2 years old and below. So if you get a chance to get hold of us, just kind of call our clinic and then schedule a well child check, because we still want to recommend vaccinations to be up to date for all the children here. So if we can catch up to their vaccines, we'll catch up with their vaccines, but we want them to be seen here all 2 years old and below. But as the surge, let's say if the surge comes, then we might have to change this, but for now, we're still seeing all these patients in our clinics, or we're still open. And then for other services, so dental, I guess it's going to be just all dental emergencies. That's what we see right now. And then optometry, so they have some certain kind of visits that it would take for optometry. So call a clinic. So we encourage you to call a clinic. So if you're always unsure, always call us, and there's going to be someone available to answer your questions.
You know, COVID is such a new thing. We're learning many new things about it every day. So there's no evidence that smudging is going to kill the virus in the air at this time. So I would have to say no. But again, we encourage you to continue to practice your traditional methods. It is not something that is going to harm you. However, whether or not it kills the virus in the air, there's no proof to that yet. Yes, my understanding is that yes, we are doing that already. That was already standard procedure before, but even more so now. We're being much more, how would you say, much more cautious and also making sure that surfaces are deep cleaned the ambulances, also anything that we provide services for.
It's important also to let the community know or request the community that if they do think they have respiratory symptoms related to COVID, to let the first responders know that, so they'll be able to protect themselves by donning the necessary protective equipment before going out to see them.